Today, Mid-South infectious disease specialist Dr. Steve Threlkeld again provided daily updates and answered questions about COVID-19. Dr. Threlkeld is the co-director of Baptist Memorial Hospital Memphis Infectious Prevention Program.
We do those things that prevent infections in general. I mean, people are wearing masks. We are washing our hands frequently. You don't want to touch your face, whether there's a mask on it or not. And if you're doing those things, you're doing everything that you can do to prevent the infection, and probably largely that's a successful strategy. We debate still how much is it possible for somebody to give it to you from across the room. We think that's very limited if possible, but we know that some of those droplets that people talk or sneeze or what have you can spray out can survive for a while in the atmosphere. What we don't know is whether those things could be infectious or not. So there's a lot of debate about that still. But I think as we begin to open things, we have been in this city particularly blessed with being sort of spread out in general. And there was I guess a New York Times op-ed, I think either today or yesterday, that talked about the fact that that's really bearing out. The people who are in the most concentrated areas are having the highest rate of disease and infection, and they also seem to have the highest severity of infection. So people, and I guess the example that op-ed gave was whether you are in New York City or in a meat packing plant in Texas or Montana, if you are very close to people and having a high amount of virus come into you, that can be a bad thing. It can be a bad thing for your likelihood to get the infection, and it may even be, and this is very early thought, but it may even be that can make you sicker. So the main thing is to spread out as much as we still can. And as you say, people, whether it be in a hair salon or restaurants, the principle is the same. Well,